It's not nice. I cry ashamo. Anyway, that's a nice one. Football brings us all together. Let me celebrate another woman who won over the weekend. My favorite so far. Diana Intri Hamilton. Back to back Diana Hamilton. Baby. It says happy birthday to you, Fafa Annan of DVLE 37 branch. It's from Isaac Entry to you. Wishing Grandma Madame Gladys Theresa Menu of Medina Emmanuel Presby Church happy birthday number 89 to you, Madame Gladys Theresa Menu from Fojo in Medina. Happy birthday to you, Sylvanus Afagbaji Banaman of the Church of Pentecost Adrianbo English Assembly. It's from your dear wife Gladys, your children Sylvia, Ruth, Sarah, Selassie and Janelle. They say God bless you, Papa Sly. Madame Esperanza Parks of Dansuman is 80. Happy 80th birthday to Madame Esperanza Parks of Dansuman from your daughter Nana Bna Yeboa and the management and staff of Reliance Beauty Outlet. We love you, Mama. To you, Kathia Amanoa Bafo Newton in Alexandria, Virginia. Happy birthday from Nana and your loved ones home and abroad. And this morning we'll have a chat with Dr. George Haramis of Luca Health Medical Specialty Center. What's about kidney stones? You know about kidney stones, don't you? We'll talk about kidney stones. And then prostate enlargement. Listen up. Dr. Haramis coming up shortly. And happy birthday to you, Dixon Kwame Odro Elias Salvate of KNUST. Enjoy your birthday, Salvate. It's from the entire Odro family to you. Happy birthday to you, Lily Agbamasu. It's from your dad, SWO retired Wilson Kwame Agbamasu. Birthday number 4 to you, Clarissa Nana Equia Adepa Danswa Odro of Stadium City Montessori in Amasaman. It's from your dad, Isaac Odro, your mom, Mina Sechibi, and the entire family. To you, Nana Equia Adepa Danswa Odro, happy birthday to you. Cause I'm a work in progress. What's it? Dr. Abena Okon, Director of Health Directorate. Happy birthday, Dr. Abena Okon from Nancy Siedu to you. Wishing Lillian Mensah of NHIA Jolo. Happy birthday from Kwesi Sika. Aaron Edu Mensah, your 8 years old. Happy birthday, Aaron Edu Mensah of Godson Preparatory School. It's from your dad, presiding elder Edu and the family. Lawyer Isaac J. Sinimako is 84. Happy birthday, number 84 to Lawyer Isaac J. Sinimako from the entire family. Mr. and Mrs. Micah, husband and wife, happy birthday to you, Mr. and Mrs. Micah of Kofodia Adreso. It's from your in-law, Ohineba Samoa. Wishing Rita, your boy of First National Bank Airport Branch. Happy birthday, Rita. Wishing Mr. D.F. Ofei of SDA Church Dansuman. It's from your dear wife, Mrs. Sufai Ofei, and the entire family. Diana Hamilton back to back. Ain't see we. And that's my prayer for you if you're within hearing range of my voice. Saying see we. Lieutenant Kanalaba Machi, good morning. I know you love this one. Ain't see we why. Now, I know there are all kinds of husbands. I did not know about organic husband. It's coming up. Listen. And all kinds of birthday wishes come through, but this one is quite interesting. It says a belated birthday wish to my organic husband. Organic pa. Mr. George Kwekunyam Esari of Bremski Construction Limited. And it says you're an organic husband, a belated birthday wish to you. Tough times don't last, so I'm encouraging you to continue. The Lord is with you. Love from your darling wife, who says love always and forever, Annie Antonio Esari. So organic wife to organic husband. Well, George Kwekunyam Esari, I hope you had a good organic birthday. And once again, happy birthday, Mamie Kuya and Tiamo of the Tema Oil Refinery. Mamie Kuya and Tiamo of Tor, aka Achim Beyonce. Happy birthday to you. Yeah. And see we Mavis Mingle Bote of Splendid Mother Care in Tema. Happy birthday, Mavis Mingle Bote. From your dear husband, Mr. Bote of Dobeta. Your children, Nyantechi Papani and Nabokai of Vilak International School. In Siwiye. Yes, Dinah. Also in Siwiye, why? Good thing, congratulations. And happy birthday, Daniel Kofi Apia. Much love from LC to you, Daniel Kofi Apia. And to you, Mami Ya Apia and Nana Ya Apia of Jack and Jill. Have a lovely day from Antina. Mrs. Stella of being Safro of Nadmo. Happy birthday to you, Mrs. Stella of being Safro of Nadmo, from your dear husband Samuel. Your children, Nana Sida and Nana Kofi. And then happy birthday, Mr. Eric Ajito of Labadi Beach Hotel. It's from Georgia, you see, and the rest of the team to you. Amen. And happy birthday number 84 to you, Mr. C.C. Anderson of Kofodia Tennis Club. It's from members of Kofodia Tennis Club to you, Mr. C.C. Anderson. From Kofi Sapomboating, Mr. and Mrs. Adase Okapi Daddy Prete. Eastern Region Sports Association and Kokrokoo Ayats to you. 84 and counting. Wishing Benjamin Holali Agbanu happy 10th birthday. It's from your dad, Reverend Benjamin Mauli Agbanu. Your mom, Mrs. Priscilla Agbanu. Your sister, Kaylia Kakali. And also from Mr. Kwanzaa to you. I'd like to wish my beautiful and supportive wife, Rosemond, a happy birthday to you. Bless you, Rosemond. Love from your husband, Superintendent Freeman Tete, and the children. They say God richly bless you in Siwiye. And Mr. Kwame Richard Jonathan Ufusu of Santa Maria is 80. Happy 80th birthday, Mr. Richard Jonathan Kwame Fusu. It's from your children and the entire family to you. And one to you, Mr. Edward Osei Kofo, aka Abele. Happy birthday to you from the members of the Gentleman's Club. Reverend Professor John Frankeshan, VC, Takrali Technical University. Happy birthday number 53. It's from Sasa and the entire family to you. In Siwiye. Madame Cecilia Mens of Kaneshi Presby, 75. Bless you. It's from your son Fawcett and all your grandchildren. Monsieur in Siwiye. Okay, let me go and speak to Dr. George Haramis. We'll be back.
Peace FM.
Peace FM 104.3. Good to meet you.
Dr. George.
Good morning.
Good morning. How are you?
I'm fine. Always a pleasure to be here.
Well, happy to have you as always, because then I know that men especially would have a good time listening. Well, for those of you who don't know, Dr. George Haramis is a urologist and a minimal invasive surgeon at the Local Health Medical Specialty Center in East Legon. And Doc, this morning we're speaking on two conditions. Well, let's start with kidney stones. What exactly are kidney stones, and how do you know you have kidney stones?
Okay, so the stones in the urinary tract, first of all, is a very, very common condition.
It's common.
Yes, it affects almost 10% of the population, which is a huge number. It can affect both men and women and even children. So you can imagine that, especially in countries that the temperature is a little bit higher.
Like Ghana.
Exactly, like the possibility of having a stone is much higher. So usually the stone formers, the people that have stones, they may have symptoms, but sometimes they may not. So that's why it is very important to get to have a screening, quite common, in order to identify whether they have a stone or not. Usually the stones that cause symptoms are the ones that they block the passage of the urine. So most commonly are those stones that are inside the ureter that they cause symptoms. But there might be also stones that they grow silently inside the kidney, and when they reach a big size, they can also cause symptoms, but they also put in danger the function of the kidney itself.
Now, what is it about the weather and the stones? What is the connection?
The connection has to do, first of all, that we lose a lot of fluids because we get more and more, we're sweating more and more.
So we get dehydrated.
Exactly. And also we don't drink that much, especially when we are outside and we walk for so long, and we forget to drink a lot. So
Drink as in water.
Exactly.
FM.
Exactly. And then what happens is the more the concentrated the urine is, the higher the possibilities for those minerals like the calcium and the oxalates and all the different minerals that we have in our urine. They can condense, they mix to one another, they fuse, and then they make stones.
So what, if you drink a lot of water, it would minimize your chances of getting kidney stones?
Absolutely. This is the number one advice we give to all of our patients. You need to drink close to 1.5 liters per day if you want to maintain a good hydration level. And don't forget, the stone needs quite some time to be formed. It doesn't happen overnight. So it starts from very, very small crystals that they need to condense to mix to one another, which means if you really drink a lot and you produce an adequate amount of urine, usually these crystals can be disposed by the body, and you don't give them the time and the chance to make a stone.
How dangerous are stones?
They can be dangerous. They can be dangerous, as I mentioned before, especially when they start to affect the kidney function, and also because some of those stones they have a lot of bacteria. The stones are never clean. They have a lot of bacteria in it, so they can cause infections and a series of other problems. And the most common thing that they can cause, and that people are maybe aware of, is this sudden stabbing pain, the so-called renal colic. That you are well now, and within 2 minutes you might have a pain that it is really excruciating, and you definitely need medical attention at this stage.
Now, you mentioned that it could affect both men and women and even children. What are the common signs? How do I know that I am a candidate for stones? What should I look out for?
First of all, certain people, they are in a little bit of a higher risk. We know, for example, people that are a little bit overweight, they tend to excrete from their kidneys and into the urine more calcium and more oxalates and all of these minerals that are responsible for creating a stone. Also, the women are a little bit more prone to make infectious stones because they have more infections than men. But don't forget that the stone starts, as I said before, from a very, very small size in the beginning. So sometimes they don't cause symptoms, or they grow silently in areas of the kidneys that you are not aware of. And when they start to move, this is where the symptoms start, and this is where the problem starts.
Well, I have a testimony here, but before I go to that testimony, so what? We need to come and check all the time?
I think this is a very good question. It doesn't apply only to urology. I think this is for our well-being and to maintain a good level of health. I think once a year, every person, either it is a man or a woman, you can spend one day just to see your doctor and make an annual screening, a basic one. It doesn't need to require a lot of things. It's just a clinical examination, a simple imaging with a scan or an ultrasound, and a physical examination also from your doctor. It's also very important to have a doctor that knows your medical history. That always makes things so easy. And even if a problem arises, it's much easier to be solved when you have a regular relationship with a doctor. So yes, I think it's very important this for all the people that listen to us right now, to understand the significance of the annual screening. It's very important.
Annual screening, Dr. George Haramis from Luca Health says it is extremely important. But there's a patient testimony here. Let's all listen to it, and then after that we'll come back to Dr. Haramis.
Menya kidney Sylvia. Menya kidney stones pain. In fact, 10 years ago, menya doctors cast me kidney stones, and then fortunately for me, menya eating about me kwabuche until me boa me share me ma bibia kama. Ain't exactly 10 years now. Me starting as symptoms no. Ain't me call my hospitals. My hospitals bebre my academy bobby. But the very last one no, and obi catch him so new hospital be or easily gone. Ain't no main try one here. The hospital meet me. Don't meet me aboa me. And na make free hon. And na me call you. Me call in fact the way omo share am kwan ho chete ma who say we yare mpo. Omo we be share me call you me show me di me here me bibia na so okay me ko hu doctor. Me call na me come asem chair doctor. Me catch a doctor no see adeɛ stone na me anticipate say ne kese ti say no enye stone na baby am hospital na me free ban e wo so mo ye me operation e wo so mo ye me no na we ometimi aya bra o mu ntwa me and am say sir na baby am free ban no mo catch him say e betwa me no so no emoja betimi atumi ama mewu nti 50-50 chances and other nti na e ha me enu nti na me de masem na ma menya obi ma ne boa me nti that can catch him so enya entisa surgery no mo be ye no omo de laser na be ye no omo ntwa enu an say omo wo tube laser ye de be fa omo ye de be fa wase na enu a ye na djuma na crash stones no na wo na obenu musuo na ni nyina ayede stones ni adanet say powder no nsuo na ni nyina besin so ene odim say ene ya kwa mbetimi aya monyema me na me hontom no see o omo e so omo book me na me say okay time ben no see o time entem ya ombe ya ama Monday no mo catch me say kwan down ntimetimi amba mo catch me say say ne be ya obe operation ne me so ye na me di so na me call nti Monday me call just say environment no kwa ma feel say we yare everybody obi very calm and peaceful ain't omo catch me so doctor no maybe say doctor and say be this saying no see you enche I'm say okay yeah me proceed bibi e say yeah me and me call inside me ni tia na be say adena mpa o mayi ana na doctor so bibi ayi okay na me no me so 1 week time me call bibi ayi okay and say me dey here nti in fact hospital hold there me recommend so bia anko honom even we unum nsuo na wo catheter na wo hu say stone powdery form no enam tube no mu e besin be hu ni nyina nti no we enye sikan twa bia asem ye ma wa bia no asori na akọ.
Well, patient testimony there. Doc, she mentioned that she had it for about 10 years and had been going from hospital to hospital, went abroad, came back, and they described or prescribed quite an invasive treatment, quite a more invasive treatment method. But she didn't get to do it. Eventually came to Luca. And from her testimony, I know you don't speak Chi, so you probably don't understand what she said. But from her testimony, it was, easy comparatively. Now, what are the treatment options at Luca Health for kidney stone removal? How do you treat it?
Okay, so for those patients that really need a surgical procedure, which means that they have a big stone that there's no chance to be expelled by itself. In this case, what we're doing is we do an endoscopic minimal invasive surgery. What does that mean is that we use very, very small scopes that are only a few millimeters in diameter, just 6 millimeters overall. And with these scopes, we can pass from the urethra into the bladder and basically reach almost every part of the urinary tract and find the stone. In this particular patient, the difficult part was that her stone was in the lower part of the kidney. This is always the most difficult part of the kidney to access, because when you go inside, you have to make a big deflection to reach that. But we're very fortunate. I feel very privileged that Luca Health provides me with all the equipment that I really need, and in particular this incredible disposable scopes that we can reach any part of the stone. And once we find and we localize the stone, we have the chance with a laser fiber. To really break down the stone in such a small pieces that can even be expelled by themselves. So what is really important is that this is an operation that doesn't require any incision. It can be done through the natural way of our body, and that speeds up the recovery very, very much for the patient. And in this case, also the patient returns home the very same day, which is huge, I think. This patient, the next day, she could return back to her normal activities.
From the way the patient described it and from how you are walking us through, it looks like it's pretty easy. Is it that simple?
No, it's not that easy. To have a good surgical outcome, you definitely need all the pieces to fit together. And at Luca Health, now that we're operating more than 1.5 years, I can tell you that we have standardized our operations and our procedures. So it doesn't, even if I'm a good surgeon, I definitely need to have a good supporting nursing staff. I must have a good anesthesia team. And we have collected a very, very good experienced team. And I think now that we have standardized all these procedures, the outcomes are very good. And as I said before, it's also, urology has been changed a lot the last few years. And technology has really changed the way we practice medicine. And you definitely need to have the right equipment. And at Luca Health, we have that. And I feel privileged that I can practice and offer this kind of treatments now.
Well, let me move on to an area. We said you were going to discuss two things. Let me move on to an area that is the headache of most men when it comes to our prostate. Prostate enlargement, common for men, and especially when you have a prostate enlargement. We have difficulty urinating. We need a catheter. We can wait for months. Very uncomfortable, very painful in some cases or most cases. Prostate enlargement conditions. Is that how it should be treated? Is that how it's treated, or you're doing something different at Luca Health?
Okay, so I like very much what you mentioned about the catheter, because I'm here almost 1.5 years in Ghana, and I'm really surprised by the high number of people that they stay with a catheter for long, which is really unbelievable because nowadays there's always options and to get rid of the catheter, because you can understand what are the consequences for a man to be with a catheter for months. I mean, not only from a physical standpoint, but also from an emotional standpoint. You feel completely isolated, and you're definitely not yourself anymore. So to get back to that, prostatic enlargement, when you reach the stage that you have a catheter, it means that the medical treatment had failed already. So there's no other options than having a surgical solution to this. And I know that most people are very much afraid of the operations. I have heard a lot of stories of bleeding, and because the prostate itself is a vascular organ, so they're very much afraid of this. But nowadays we have changed a lot our practice again. We have moved from open surgeries to minimal invasive endoscopic surgeries through the natural way, through the urethra. And even though these operations are not new, because in urology we started doing these operations more than 20 years ago,
So how come we don't have it in Ghana?
No, we do have it in Ghana. We do have this kind of approaches, but what has really changed and what we make differently at Luca Health is the type of energy we apply to the prostate. And we offer to our patients that they need a surgery, either a laser prostatectomy or a plasma vaporization. These are two very, very, the concept of both operations are the same. The important thing for the patient to know is that we can remove the part of the prostate that is blocking the passage of the urine in a safely way and on an outpatient status, which means that the patient is coming in the morning. We can do the procedure, and the same day he can go home. And what makes us so confident to do that is exactly the type of energy we use, because we can remove the prostate without causing bleeding. And that's why we don't ask before the operations for any blood units to be there in advance. And there's no transfusion.
You can remove the enlargement without bleeding?
Yes, absolutely. And that's why this is what makes us a little bit very different from other kind of procedures that we can apply this energy to the prostate, we can remove the prostate, at the same time we coagulate the vessels. So that is the reason why we're confident enough to send the patient home the same day. Otherwise, we wouldn't be able to do so.
Wow. Let's hear the testimony of another patient who was there.
Now, I friend me, Peter Misa Sesu. Now, I was so many young watching, no pay me sorry, right? Me person me doing something to me so. Now, no matter no, it's I can exercise, can cry who and can wait to me. I don't so. So me, I'm into me so. To me, can I'm more by cram and yet. No. I said, no, my hospital. A clinic was rancing. With 2 minutes, when doctor and pom by. I'm a bread.
Peace FM.
Say, also, it's why I'm surgery. And so, only room sending out by Yanafa. I send me one son, I'm a quadam, I am it. See, I mean, why to 1 minute transit. Send obey me here will be original home for not less than 14-21 days. Madame Panaso means from. Yeah, because we try me as saying yeah, they me by Monday, or weekend, me by Monday. I know it's me from Monday now to Friday. There's a weekend or call by another Monday, I'll be for another 1 week. There's a 14 to 21 days, so I'm still matter me that's it. I mean, the kind of I met the whole 2 weeks, no 3 weeks. Okay, let me cook regional hospital. Also, me no could discuss any me doctor no hano, and almost the same things and all kind. No, we could the original hospital. To me, baby, so I cry. A police in me catch them no. Also, okay, we research and work. To me, one of friends say, look out, on say that no, I cry over coffee. I say, wow, that no, me make coffee. I could not before some that not less than 14-21 days. No, a handsome was not less than 14 days. And he ain't finding out to it. Tell me finding out me buy and be who Dr. George and no money idea. Better say, yeah, the necessary before that, I check out be COVID in my yen day. Until they did no buy me ban of Pabia 8:30 to 9. About 2 hours, 3 hours later, who says I better be near her. So less than 4 hours. Maybe I my fuck on my if I text because now me ban send to me I won't call. But I could have driven all right. Until 4 hours time I buy me share my tire. Bye me coffee. Coffee, where 3 days time I buy an uncle ye, you know. Wow, I'm not a hospital. No, I see no Yamiadum, me, but service I mean, any day. Perfect. And you look at there, only a young coupon, we young boy, only do. I think they have helped me a lot because the pain I went through, no, I'm a bar within less than 3 hours, you know. Now, there was no cuts, there was nothing. And after 3 days, I remember Dr. George said, the person didn't go through in your ear. Because me who cut behind and he was so fine enough, me go through. Treming, Yadaju, me home, bear 1 hour. Treming, Senia, or the instrument to be sharing, a squeezy, a scoopoo, a free, the ultra, and a screen boho. And to what is going on there. After that, and then we are meaning WhatsApp. Me channel, me, or some problems make it. And if I had more be brave, meaning be brave. And look over there, I have one.
That's another patient testimony, and I'm coming back to my question now. It's very simple, isn't it? You guys make it look like child's play. Because from the way he described it and from how the procedure was done and the after procedure relationship he's mentioned as well. You're making it seem very easy.
Actually, all minimal invasive procedures, they have this big advantage because the patient doesn't experience the pain of an open incision, for example. So from the moment you finish the operation, okay, you might have a catheter for a couple of days, but you already don't have any incision, so you can really ambulate yourself. You can move from the very first day. And I think that is very, very important for the patient from the healing standpoint, but also for his morale.
Yeah.
I mean, it's a lot different to know that you're going to be in a hospital and you stay for 1 week, 10 days. And also the you might face some infections in the hospital or stuff like that. So the fact that the operation can be done safely and within a few hours you will return back home, I think it's very important for the patient. And even if you have a little bit of a setbacks, you can really cope with that much easier because you know that the procedure is not going to be so painful. And especially most patients are more afraid of the bleeding and the consequences of bleeding. And this is something that we can guarantee that it's not going to happen. And all these things together, I think they make a very positive experience for the patients.
And so, apart from kidney stones, which we've talked about earlier, we've got patient testimony, and prostate enlargement, we've just got patient testimony. Somebody said to ask you, how about gallstones? Is there anything like that, gallstones?
Yeah, of course. Our general surgeon that is dealing with this kind of procedures, what we're doing is we can do a laparoscopic procedure for people that need to remove their gallbladder. Laparoscopy means that with 3 small cuts of 1 centimeter each, which is a very small one, we can go inside the abdomen and we can remove the gallbladder, and the patient also can return back home the same day because the burden for the organism is very minimal, and you can recover very fast. So yes, gallbladder operation nowadays is considered an outpatient operation, and we standard practicing that. Our general surgeon there, Dr. Alex Rakovitz, is doing that.
Oh, Dr. Alex, my guy.
Okay, yeah, he's doing that very, very regularly. So, yes, it is a procedure that can easily be done at Luca Health.
Okay, so somebody has been diagnosed with kidney stones, prostate enlargement, doesn't know what to do. What would be your advice?
First of all, you have to make an appointment with your doctor. I mean, don't be afraid to go to a doctor, because I think a urologist will really study your case. Not all cases, first of all, require surgery. Eh? Don't try to make the people believe that all people who have a prostate or a kidney stone necessarily will require a surgery. But in case there is a need for a surgery, that can be done in a very minimal invasive and safely and a safe way. And especially for those people with a catheter, which is my sensitive point actually as a urologist, because I know how much they suffer when they come.
Yeah.
I strongly advise them to don't be afraid. Come to a urologist, make your appointment, and we can really take care of you. And we have all the means necessary to make you get rid of it.
Where will I find you? Well, I know where to find you, but where will my listeners find you?
Okay, we are at East Legon. We are at 27 Maseru Avenue. We are at the same campus with MDS Lancet Laboratories, just behind the Mensvik Hotel. We operate from Monday to Friday from 8 to 5. So whoever wants to make an appointment with us, can call to our telephone center and make an appointment. The number is 0544 120 777.
0544 120 777.
And those who want to learn some more information about Luca Health and our specialties and the services we provide, you can also visit our website, which is lucahealth.com, and then you can find all the doctors and the providers and all the services that we can offer to our patients, and we're more than willing to meet these patients.
Well, so Dr. George Haramis is a urologist, minimally invasive surgeon at Luca Health. And, he said it all. If you're looking for it, go find it. Well, for me, I know Luca Health, and I know what it is that they do. Well, George, thanks a lot.
Thank you so much. Have a great week to you and to your listeners.
And have a great week to you and the team at Luca Health. Thank you very much. Shouting out to you, Dr. Udell, Dr. Alex, Dr. Jeanette, to you, Fusaina, and to all the lovely nurses and other staff at Luca Health. You all go ahead and have a beautiful day. And happy birthday to you, Richard Papa Kwanzaa. And you're Richie Plantation, ba. Richard Papa Kwanzaa, happy birthday to you from your dad, Mr. Richard Kwanzaa of Richie Plantations. It's from your mom, your siblings, and your uncle Mickey Darling. A belated one to you, Dr. Ben Ochiri Ankra of the Central University from Team Kokrokoo. Much love to you, Dr. Ben Ochiri Ankra. Happy birthday, Paul Urasichi, from your dad, Dr. John Kofi of Mab Hospital, Nyamiche. Gabriela Kusia Krama Eje Kumi. Happy birthday, Gabriela, from your mom, Sandra Odrom. Also from Frimpoma and Grandma Faustina Aka. To you, Yoko of Cell in Takrady and Achim Swedru, good morning. Here's your song. To you, Kenal GKT Sam, here's your song too. Have a good one, guys. And a belated one to Nana Kofi Opoku-Osei. Belated wishes, Nana Kofi Opoku-Osei of Bediako Memorial Institute. It's from your dad and mom, Mr. Michael Osei and Sophia Opoku-Osei. Your siblings, Miadwa Frakuma, Ohima Efia, and Oreko. To you, Bema Asari Bediako Ado. Happy birthday, Bema Asari Bediako Ado of Maritime Hospital Tema. It's from your brother Christian Okonfo-Addo of Preseg Boys Legon. And to Master Samuel Adote Tete Jr. of SOS Suhun. From your parents EMT Samuel Adote and Uncle Animal Richard of National Ambulance Service in Kofodia. It says to the most beautiful, lovely, sweet, intelligent lady I ever met, Agbenu Rita Aku of Advanced Ghana Savings and Loans. Happy birthday to you, Agbenu Rita Aku from Kofigo. Bedem 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 ba-ba-dum. Here we go. Here I Ampa. And once again, happy 80th birthday, Madam Esperanza Parks, formerly of GBC. It's from Mama Safua to you. Wishing you blessings. And happy 18th anniversary and special thank you to you, Mrs. Ajuan Nyanten Yenyo of UNFPA. It's from your dear husband Fifi Yenyo of WFP. A belated one to Inna Kofi Uso of Sestag. Yesterday was yours. Best wishes from Mike, Nana, Joa, Kukua and the Ashan family. And congratulations, Benjamin Obri Dansu and Juliana Osei Okaimbia. It's from Kakra Ping and all your guys to you.